today we're going to do upper limb neurological examination. Firstly, we have to wash our hands, introduce ourselves, gain consent, and also expose the patient's arm adequately.
So, good morning, Miss. My name is Marzana, medical student. I would like to do an upper limb neurological examination on you. So, can I proceed? Yes.
First thing first, we need to inspect, observe for clues around the bed, look for the general appearance of the patient, any limb deformity, any posturing, any scars, any wasting of muscles, any involuntary movement, any fasciculation, any tremor.
So, Miss, can you do like this for me? You. And close your eyes. Thank you, Miss.
Next, we would check for pronator drift.
So, Miss, can you help me by doing this? And close your eyes for me. Okay, thank you, Miss.
Next, we will assess the tone of the upper limb.
Do you have any tape? No. Miss. Here, how about here? Do you have any tape?
Next, we will assess the power of upper limb.
So, Miss, can you help me by doing this? Can you push my hand? Okay. I'll push my hand. Thank you, Miss. Can you do this? Push my hand. Okay. Push my hand. Like this one, you do like this. Okay. Okay. We have to do this.
3.
Miss, can you do hands like this? Okay. Hold my hands. Okay. Okay. Now, push my hand. Okay. Okay, Miss. So, Miss, I'm gonna knock your hands once. It's a bit uncomfortable, okay?
Next, we will check for the left bicep reflex, tricep reflex, and also supinator reflex. Next, we will assess the sensation for the upper limb. We would like to do the light touch sensation first using a cotton wool.
So, Miss, now we're going to check for your sensation. So, can you feel this? Yes. So, I'm going to put this on your upper limb. If you feel this, please say yes. 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 So now we're going to test on your left limb. Yes. 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 Yes.
Next, we would do a pinprick sensation using an orange stick.
So, Miss, now I'm going to check for your pin sensation. So, it's a bit uncomfortable. So, if it's the same with the previous one. If you feel this, can you feel this? So, I'll put it on your upper limb. If you can feel it, this says yes. 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 Now I'm going to check on your left limb. Yes. 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 Yes.
Next, we will assess the proprioception.
So, Miss, this is going to be up and this is going to be down. So, can you close your eyes and tell me whether it's up or down? Up, down, down. I'm going to check on your right limb now. Close your eyes, miss. Up, down, up.
By doing a finger to nose test. Next, we will assess the coordination by doing a finger to nose test.
Can you put your hands on your nose and touch on my fingertips? So now on your left knee, miss.
Next, we will do this diadochokinesia.
Miss, can you help do like this? And do this repeatedly. Okay, how about on the other side? Okay.
To complete our examination, we would like to thank the patient, wash our hand, and do a further assessment.
Okay, that's all, miss. Thank you.
Hi, in this video, we will demonstrate on neurological examination of the lower limb.
Before examining, introduce and ask for patient's consent.
Hi Miss, I am Hanis from UNIMAS medical student. Today I would like to examine your lower limb. Is it okay for you? Yes, sure. Thank you.
Expose patient ideally from groin to below, but for patient modesty, expose from mid-thigh to below. Inspect the patient from standing position and compare both lower limbs. Look for any scar, deformity, skin changes, and muscle wasting, anteriorly, laterally, and posteriorly. Then, ask patient to lying supine.
Miss, can you please lie on the bed?
Then, check for tone to look for hypertonia, hypotonia, or normotonia. Check for power.
Hip abductor, hip abductor, hip extension. Can you raise your right leg? This one. And hip flexion. Please bend your knee. Push my hand for knee extension. This one. Push. Bend your knee again for knee flexion. This one. Check for the ankle for the dorsiflexion, plantar flexion, for subtalar inversion and eversion, toes extension and toes flexion. Now check for the knee jerk. Check for the ankle jerk.
Next, check for Babinski and Clonus. Then, check for sensory by using orange stick. Use forehead as reference.
Miss, this is a sharp sensation. I will test on your forehead. Can you feel it?
Yes.
Now I will test on your lower limb. Please close your eyes. Tell me if you feel sharp. L1 will be at the groin area. L2 at anterior thigh.
Yes. Yes.
L3 at the anterior knee.
Yes. Yes.
L4 at the medial aspect of the leg.
Yes. Yes.
L5 at the dorsal aspect of the foot.
Yes. Yes.
S1 at the lateral aspect of the foot.
Yes. Yes.
Lastly, S2 at the popliteal fossa.
Yes. Yes.
Check for proprioception.
Miss, this is up and this is down. Please close your eyes.
Up. Down. Down. Up.
I would like to complete my examination by examining the autonomic nervous system, vascular system, and also per rectal examination.